Next button. The result is conflict. And this is the conflict that many of you will have been subject to at the moment. You will have come across many doctors who believe that the illness you suffer from is generated by a disordered mental process. In other words, some form of disorder within your subconscious. And the phrase which is often peddled in this situation is an abnormal illness belief. Now, in my view, abnormal illness belief as a cause of disease is probably, should be relegated to the dustbin of evil spirits, the wrath of God, and so on and so forth. And I'm looking forward immensely, as Mark Twain suggested, to what's going to happen next. And Judy Mikovits, I know, will be able to provide us with some further insights into the real science of this disease later this afternoon. But I need to hand on now before I start. I continue talking too much. But thank you very much.
Thank you, Willie. We're going to actually have a question and answer panel to the audience questions after actually the first part. So rather than actually ask for questions now, we'll ask for questions at the end of the first part of the session. My job now is to actually just give an overview of what the state of the art is, and it's under Gizmo. Some people actually who were at the Belfast meeting exactly 12 months ago, also a sort of a standing room audience. This group is a fantastic organizing group. And as I said, Rich Van Konenyberg was invited to actually join our panel, but unfortunately he died actually 3 months ago in his sleep. Rich was not a doctor, not a medical experimenter. He was an engineer, and he had experience with one of his friends who actually suffered from ME, and he devoted the last 12 years of his life experimenting on the methylation cycle. And you'll hear a little bit more about that as I proceed. Next. At Mount Sinai, we formed an Me CFS group because one of my patients actually graciously donated a massive amount of money to the medical center, and the dean in response said, well, that requires a specialty group, and we'll actually call it the Mount Sinai Me CFS group. And we're actually doing genomic research under Eric Schatt, who's a world-renowned geneticist. We're actually looking at virology, we're looking at immunology, we're doing clinical research, and we're basically now also doing a post-malaise study. What is a post-exertional malaise? Post-exertional malaise is, as a lot of you know, when you actually exert yourself, the actual consequences are not seen immediately on the completion of the exertion. They occur 24, 36 hours later. Why is this? We're not sure. In fact, actually, one of the methods that the MRC and the CDC in America suggest that perhaps exertion and exercise under the term GET, graded exercise therapy, might be a means of treating this disease. Well, we're not sure, and we're actually going to try and see what is the cause of this PEM, is one of the criteria in the Canadian consensus. Next, Hans. An overview of the pathogenesis, or the cause of this disease. It's being actually studied in many centers. Nobody actually has come out with the etiology and diagnosis. Judy actually excited us a couple of years ago because we thought actually we were starting to actually understand that. And Judy's probably actually going to tell us actually the sequence of that. Potential treatments. The treatments actually, there is no accepted universal treatment. We actually have been looking at treating the immune system. Next, Horace. The immune system is seen actually to have numerous abnormalities in cytokines. It's got a Th2 phenotype. The cytokine regulation is abnormal. Infection of the, has actually been suggested in this disease: virus, bacteria, mold, prions. That's maybe a new term for some of us. Nervous system actually sees actually various abnormalities: paresis, visual loss, ataxia, confusion, abnormal metabolism, and peculiar non-specific brain scan abnormalities, which we think are not specific to this disease, but we're not actually exactly sure what these non-specific abnormalities are. There is abnormalities in the HPA axis, cardiovascular system, vasodilation, hypotension, low blood pressure, and various other manifestations of the cardiovascular system. Psychological function. Now, we have to actually congratulate Simon Wesley on actually being recognized and given an award last week or 2 weeks ago. Perhaps actually I'm actually 180 degrees in the opposite direction from this idea. Can there be depression in this disease? Yes, of course. There's depression in sarcoidosis, there's depression in tuberculosis, there's depression in leukemia, there's depression in cancer. Does that mean that depression causes cancer? Of course not. Can there be depression in ME? Of course there can. It's secondary depression. The same way as one can have secondary depression in cancer, one can have secondary depression in ME. Should it be treated? Of course. If it's bad, it should be treated, but it is not causative. Genetic predisposition. Now, let me actually mention one of my friends who unfortunately has disappeared from the scene, Jonathan Kerr, a Belfast man. Jonathan, we're sure you're around and we want to hear from you. Jonathan actually was a great researcher and worked actually at George's in London and did a research on a genome. I sent him the specimens from New York, and he actually did the genomic research and showed actually that there was abnormalities in the genes of patients with this disease. Next, Horace. So what do we got? I'm sorry, are you losing me? Yes. The etiology or the cause of this disease, as Willie has mentioned, and as Charles, I'm sure, will mention, Ramsey actually suggested that this Coxsackie B might be one of the factors that cause this. Well, we have found actually that Coxsackie B are seen in some patients, but in a number of patients, Coxsackie B is not actually present. There actually have been other viruses through the years, and we'll actually see those enumerated a little later. Mycoplasma, Nicholson suggested. Some patients don't have mycoplasma. Bacteria, mold, fungi, and prions have all been suggested, but none of these have been proved as the etiological agent. Next. We're going to flash through these next slides. Next. So, I think we've gone backwards. Go ahead, next. Virus as a causative agent. Well, why actually do we actually think that Me CFS might be caused by a virus? Well, it has got certain points that simulate viral disease. It often starts with a flu-like illness. Symptoms wax and wane. There are antiviral pathways are activated. Me CFS symptoms are similar, to many viral conditions, including Epstein-Barr and Ross River virus. There's geographic outbreaks, as Willie has suggested. Actually, there was the outbreak actually in the 1880s. There has been the outbreak in 1955. There's the Icelandic outbreak. There's been the Incline Village outbreak, and there have been the New Zealand outbreak. Does that actually mean that this is a virus? No, but it actually points in the direction of some etiological agent. Gene expression profiling has found genetic variations that impact viral defenses, and there are antiviral treatments that have been effective in small studies. Ampligen, isoprenosin. Isoprenosin, by the way, actually is manufactured in Swords outside Dublin. Beta interferon, vanganciclovir, and certain antiretroviral agents. Next. Some of the viruses that have in the literature been seen. The interesting thing is that the first group, human herpes viruses, is a group of DNA viruses, and these DNA viruses include HHV6, which Blasey actually has done a lot of research on. Next. And the HHV6 virus shows actually a certain predisposition to causing this illness. Next. I'm not actually going into, this is actually a slide that was produced for a virology lecture. It has several variants, and the variants actually can cause, interestingly enough, this paragraph, the penultimate paragraph, can cause encephalitis, amnesia, chronic myelitis, and in some cases transverse myelitis. Next. So the infection has actually disturbed key immune activating pathways. So it basically fits with some of our thinking of how actually this can affect the patient. It also depletes CD4 T lymphocytes, upregulates the TNF alphas, and it has actually got some of the fit for what we see in this disease. Next. HHV6 does actually enter tissue. Here actually we see HHV6 virus in heart muscle, in the myocardium. And we know actually that there are certain, as I pointed out earlier, certain myocardial issues in this disease. It also can enter brain tissue. Next. And here is HHV6 in an astrocyte. An astrocyte is a cell, a brain cell. Next. So some of these ideas of antiviral treatments have been actually looked at over the years with certain effectiveness. Next. Methylation cycle. Here is Rich Konenyberg's prime research. He has shown actually that the methylation cycle is defective in this disease. This is a complex slide. It's meant to be complex. You're not supposed to be able to understand the intricacies in it. It's because I want to actually show it is complex. This disease is a complex disease. It is not actually just a simple disease of depression, and you get rid of the depression, you get rid of the disease. You've got to actually go into the metabolic processes in this disease. Next. And what we've actually done is we've actually tried to find a method of, with Rich Van Konenyberg, a method of treating actually this abnormality in the methylation cycle. And this is a method actually that we've been studying with a substance actually originally called Cutopressin. Cutopressin was made by a German company, Schwarz Pharma. They actually ceased producing the Cutopressin, and we actually then used Hepapressin, which was a follow-up substance. And our clinical trial actually started in 1994, and actually has been added to sequentially. Next. The current treatment is using Betamax. Somebody asked me what Betamax is. Well, B12 has been used actually for decades in this disease. The problem is with B12 is very poorly absorbed if it's swallowed, if it's taken orally. there needs actually intrinsic factor to be absorbed. So one actually has to normally give B12 by injection. Well, nobody actually likes, most people don't like injections, but we found actually that if you sprayed sublingually under the tongue, methyl B12 is absorbed directly into systemic circulation. Electrolyte is based on Blasi's work in Barcelona. His substance was called Recup or recuperation, and was actually a substance that helped muscle pain and muscle fatigue. Catapult is helpful in brain fog, and it provides some aspect of lessening the brain fog in form of concentration loss and memory loss. Next. Immunoprop contains glutathione, and that is based on Rich Van Konenyberg's work in this methylation cycle. And Immunoplus, he also described actually an abnormality in the folic acid, folinic acid metabolism. Next. And this is the major pathways, and on the next slide you'll see actually where these things fit. Next. The methylation group is a source for synthesis of DNA and synthesis of glutathione. It coordinates sulfur metabolism and produces DNA. Next. The actual part of the methylation cycle that is affected is the prime route from methionine to homocysteine to glutathione. Next. And the substances, glutathione and folic acid, are shown here. Next. Hepapressin, cutapressin, we've actually talked about. These are amino acid extracts. Van Gang-Cyclovir, Jose Montoya did the prime work on valsite because HHV6 can actually be very high. It can have a very high titer, and Jose actually said when the titer is 640 or above, you can treat this with Van Gang-Cyclovir, which is relatively toxic. We actually saw a case of very high HHV6 of 1280, and a patient actually who had retinal uveitis. The patient actually lost their vision, was actually clinically blind. We treated her with valsite, 450 milligrams.